I'm very passionate about what I do. I've been involved in one way or another in medicine since I was 18 years old. Actually, when I was 15, I was playing baseball. I injured my back and I got exposed to physical therapy, and that was my first encounter in medicine. I loved what they were doing that allowed me to get back to what at the time I was really passionate about, which was playing baseball. And after that experience, I decided to become a physical therapist. When I entered medical school as a physical therapist, I already knew that I liked the rehab field, but being exposed to all these different specialties and disciplines through all the clinical rotations, there were a few that I really liked and enjoyed. But at the end of the day, I knew that my passion and my best fit was in physical medicine and rehab. I enjoy that part of getting people back to active life from any kind of injury. Right now with my specialty, I'm blessed to be able to treat so many different conditions that have an impact, a direct impact in the patient's quality of life. One great thing from what I do on a daily basis is that when I interview my patients, I ask them what are their goals, and not just from the standpoint of getting their pain better, but also what things they can do now that they were able to do before. So I can see that progression from when I see the patient first and they tell me that they cannot pick up their grandkids or they cannot run a mile. And after treating them and seeing them being able to accomplish that, it's a blessing. It makes me really happy. In physical medicine and rehab, our focus is on function. And with my specialty and my subspecialty, where I can combine then different injection techniques to help the body heal, I offer a comprehensive model. In this model, I'm not just treating the joint per se, not just like the cartilage, but I'm looking at the whole unit. For example, if you have knee pain but you're overweight and you're smoking, we need to get you to quit smoking. We need to get you to lose weight if we are to prevent further injuries and also give you the best outcomes for the longer time possible. One of the most challenging things of what I do is that at this point, these treatments are not covered by insurance. So it takes a lot of education from our team to the patient, to the community, to explain what we do and why we believe this is the best option for them. The name Regenomics is actually a combination. So Reg is from regenerative, and omics, it's a branch of genetic medicine that study things that happen above the genes. Before, we thought that your genes were, that once you were born with a certain set of genes, that was your destiny. But now we know that we can affect how your genes express. So in other words, we can turn off, turn on different genes by how you live, by how you eat, by how you move, how you think. Pretty much everything you do and all your environment has an effect in how your genes express themselves. So since my approach in my practice is going to be more comprehensive model where we combine lifestyle factors with also the regenerative components, that's how Regenomics came about. Well, for one, I'm a long life learner. I'm always studying, learning something, reading, listening to podcasts, reading books. So I'm all about learning, and also I'm constantly looking at different technologies, different things that we can have in our office to be more precise, be more objective, and get the most data points, and especially the ones that can be more impactful. So I feel that my background in physical therapy prior to going to med school, it's solidified my passion for the rehab medicine. I completed a residency in PM&R, or physical medicine and rehabilitation. After that, I completed the only ACGME accredited fellowship in the US that combined pain medicine with regenerative medicine. And over the past few years, I've been able to practice and hone in all my talents and skills into a special set of services that we offer at Regenomics. We want to position ourselves as the go-to place for regenerative orthopedics. and orthobiologics. Eventually, as in the next coming months, we'll be adding other services such as the epigenetic coaching. We would like to create a model that it's a comprehensive one that provides the best outcomes, combining not just the orthopedic part of the practice, but also the lifestyle component. I feel that combining lifestyle factors with regenerative orthopedics, it's the future of orthopedic medicine. I feel this is a new health paradigm. The traditional model usually for joint conditions, arthritis, sports injuries is where you treat first with conservative options, including therapy, exercise, medicine, corticosteroid injections. But if those fail or those are not successful in providing the benefit that you expect, then the next step is usually surgery. Now, what we offer is a bridge between conservative management and surgery. What we offer at Regenomics, it's an option that you don't necessarily need to have surgery for your condition. So you can visit us and learn if any of our treatments is an option for you. I feel that the current model of medicine is more of a sick care model, where if you go with a joint problem or a back pain, they will look at the MRI, they will look at the X-ray, they'll come up with a diagnosis, and then they're quick to do either steroid injections or offer surgery. But I feel that there are more things that need to be addressed before anyone goes into surgery. There is a saying that less is more, so I also believe that it's better to use the needle than the knife. And prior to the needle, actually, there are many things that need to be offered for our patients and clients. So what we want to do at Regenomics is offer a comprehensive model where we look at you as a whole, and we have more objective data, and if you have any neuromuscular deficiency, we address that. If you have any nutritional deficiency, we address that. If you have any kind of instability in your joints, we address that as well. One explanation that I like to tell my patients is, if you have your car and you have some loose lug nuts and your tire is wobbly, you're just not going to change the tire if it wore off. You have to tighten the lug nuts, and you have to look to balance those tires, to look at the car in a more comprehensive way. So that's what we do with your body. We just not change your tire, we just not put a patch on your tire, we look at the whole unit and we treat all of those.